influence of aging process on the immune system, and in particular on the population of the T and B lymphocytes. And we talk about immunosenescence. Much attention has been paid to improvement in function of various organs and systems as a part of the chronic disease treatment and reversal. And increased longevity, yet somehow the function of the immune system is often being inadequately addressed. We wish to change that. The main content of the book is presented in 4 parts. The part 1 discusses general questions of immune system and its complexity, influence of aging process on the immune system, and in particular on the population of the T and B lymphocytes. In a separate chapter here, we talk about immunosenescence. As aging occurs, the immune system undergoes profound changes which are collectively termed as immunosenescence. Aging affects a wide range of cell types, including hematopoietic stem cells, lymphoid progenitors in the bone marrow and thymus, thymic stroma, mature lymphocytes in secondary lymphoid organs, and elements of the innate immune response. At the functional level, these changes translate to an increased susceptibility to infections and suboptimal vaccine-induced protection. Furthermore, infections in the elderly are characterized by having more severe symptoms or prolonged duration and with a poorer prognosis of the disease. As a part of understanding of the immune system and its age-related shifts, authors describe thymic decline. The total amount of lymphatic tissue declines progressively by 5% per year during the first decade of life, which is also known as phase 1. From ages 10 to 25, or phase 2, the volume of the TES, thymopoietic epithelial space, and PVS, the non-thymopoietic perivascular space, are nearly constant as the PVS grows to its maximum, whereas the TES decreases. In phase 3, between age 25 to 40 years, thymic involution continues at approximately 5% per year rate. Since both TES and PVS decline, and a considerable fatty atrophy of the thymus starts. Phase 4 starts at about the age of 40 and features a very slow involution to the rest of the lymphatic tissue at 0.1% per year. Aging of the immune system, described as immunosenescence, is characterized by reduced ability to fight new infections, diminished vaccine immunity, and reduced tumor clearance. To a large extent, immunosenescence is linked to thymic involution. This phenomenon results in structural alterations as well as functional decline, leading to a significantly decreased thymic output of naive T cells, thereby reducing the diversity of the T cells' antigen receptor repertoire, which leads to the accumulation of old immune memory cells and disrupted T cell homeostasis. Hence, aging is associated with deterioration of the lymphoid stroma on the secondary lymphoid organs. One of the most profound age-related changes in the T cell population is the decrease in the number of antigen-inexperienced naive T lymphocytes and the increase of antigen-experienced memory and effector cells. Although a diverse naive CD4 T cell compartment is maintained for decades despite minimal thymic function, A dramatic and sudden collapse of diversity occurs after the age of 70, which results in severely contracted cellular repertoire. Similar changes in the CD8 T cell pool occur even in the earlier stages of life. As a result, the immune system's ability to respond to new antigen decreases.